Good morning, sir. I am Jerico, your student nurse for today from Columban College. And today I'll be assessing your ears. It's essential for monitoring your ear health. I'll use an otoscope with different specula sizes. I'll explain each step, why it's necessary, and how you can cooperate. Okay, first is I'll be performing a proper hand hygiene. Now that I have worn my gloves and I already performed a proper hand hygiene, I will now provide a client's privacy. I will close all the windows and the doors for the client privacy and make sure that this will be confidential between me and the attending physician. Now I'll be asking the patient for his past medical history. I will ask you some few questions lang po regarding on your past medical history. Sa family history po, do you have any hearing problem or loss? Presence of ear problems? Any medication po? Any hearing difficulty? Any use of corrective hearing devices? Okay, the patient has confirmed that he doesn't done or experience any of those given situation. I will now proceed to the assessment. For this assessment, sitting position is the best position for the patient. Now I'll be inspecting your auricle. I'll start by inspecting your auricles for symmetry of size and position. As I observe, I don't see any signs of abnormalities that include redness, asymmetry, or malpositioning. The auricle are symmetric in size, similar color, and proper alignment. Next is I'll be palpating your auricle. Now, I'll gently palpate your auricle by checking for texture, elasticity, and any areas of tenderness. As I observe, I don't see any signs of tenderness or abnormalities in texture that could suggest infection or inflammation. Next is I'll be inspecting the external ear canal and the tympanic membrane using my otoscope. Using my otoscope, I'll examine ear canal for cerements, skin lesions, or pus and blood. Okay, as I observe, I don't see any signs of or presence of cerumen, lesions, or abnormal tympanic membrane. The ear canal are clear and have healthy tympanic membrane. Next is I'll be inspecting your tympanic membrane for its color and gloss using my otoscope. Okay, as I observe, I don't see any signs of abnormalities such as inflammation or infection. Next is I'll be doing the gross hearing acuity test for a normal voice tone. I'll be saying some few words or phrase lang po. Can you please repeat after me? Can you please also close your other ears po? Okay?
The weather is good.
The weather is good. Okay, sa kabila naman po.
The weather is good.
The weather is good. Okay, as I observe, the patient has a normal hearing, involves an appropriate response to everyday voices and tones without signs of difficulty. Next is I'll be performing the watch tape test. Can you please cover your right ear lang po? I'll place a watch on his ear in 2 cm po. Let me know po kapag naririnig niyo po yung clicking sound. Sa kabila naman po. Okay, as I observe, the client has the ability to hear the ticking sound clearly. Next is I'll be doing a Weber's test using my tuning fork. Okay? I'll be performing Weber's test to check for relativization of sound. Naririnig niyo po. I observe the sound are perceived equally on the ears of the patient. Next is I'll be conducting a Rene test. Using my tuning fork, I'll compare the air and bone conduction. Can you please tell me po kapag nag-stop na po yung vibration? Okay, as I observe, the air conduction is heard longer than the bone conduction po. Now that I'm done with the assessment, I will now be documenting all the possible findings on the ear assessment. Now that I'm done removing my gloves on and doing a proper hand hygiene, I will now proceed to the documentation. As I observe based from the assessment of the patient, from the beginning and at the end, I don't see any signs of abnormalities or certain conditions. I don't see any signs of lesions, inflammations, or any abnormalities. The patient can well perform the Weber's test and the Rene's test, and the cerumen of the ear is intact on the ear canal. Also, the patient is comfortable doing the process. Thank you so much for cooperating po. I will now be referring you po to the attending physician. Good morning, ma'am. I am Jerico, your student nurse for today from Columban College, and today I'll be conducting a assessment for your nose and sinuses. But first, may I know your name and age po? Okay, to inform you po, this assessment is essential part of your overall care po, allowing us to evaluate the health of your respiratory system, identify any potential issues, and tailor our approach to your individual needs po. Okay, but first I'm gonna be performing a proper hand hygiene to avoid the spread of microorganism. Now that I have worn my gloves, I will now proceed to the client's privacy. Now I'll be closing all the windows and the doors for the client or the privacy of the client. And I will reassure you, ma'am, that this will be confidential between me and the attending physician. Now I will proceed to the medical history of the patient. Now I'll be asking some few questions lang po. First, do you have any history of allergies?
None.
Difficulty breathing through nose po?
Wala.
Sinus infections?
Wala.
Injuries to your nose po or face?
Wala.
Nosebleeds?
Wala.
Are you currently taking any medications?
Wala.
Have you noticed any changes in your sense or smell po?
Wala.
Okay, the patient has confirmed that she hasn't done or experienced any of those given situation. I will now proceed to the assessment. Okay, before the assessment po, please make yourself comfortable po, preferably in seated position as we proceed to the assessment po. Okay, now I'm going to inspect the external part of your nose for any deviations in shape, size, or color. I've been looking for any flare or discharge from the nose po, using my pen light. Okay, as I observed, the external nose is symmetrical without significant deviations po. The skin color is consistent and there is no flaring or discharge. Okay, now next is I'm going to palpate the external nose lang po to see if there's any tenderness, masses, or displacements of bone and cartilage. Okay. Okay. The external nose is non-tender po without palpable muscles, and the bone and cartilage structures are symmetrical po. Okay, now I'll be assessing the nasal patency po. I'll assess the patency of both nasal cavities. Please close your mouth po, and I'll ask you to exert pressure on one nostril while breathing on through the opposite nostril po. Okay, can you please close po. Inhale, exhale. Sa kabila naman po. Inhale, exhale. Okay, as I observe, the nasal cavities allow easily airflow when alternately occluding one nostril while breathing through the other. Okay, next is I'll be inspecting the nasal cavities po. Using my pen light, I'll inspect the lining of your nasal cavities. This involves tipping your head back slightly and carefully, inserting the spectrum to avoid any discomfort po. I'll be looking for redness, swelling, growth, or any discharge. Okay, can you slightly tilt your head lang po? Okay, as I observe, the nasal mucosa appears pink, moist, and without signs of redness, swelling, growth, or abnormal discharge po. Okay, next is I'll be inspecting the nasal septum po. I'll specifically inspect the nasal septum between the nasal chambers for any abnormalities or deviations po. Can I take a look lang po? Okay, as I observe, the nasal septum is midline without significant deviations po, ensuring unobstructed airflow through both nasal passages po. Okay, next is I'll be inspecting the maxillary and frontal sinuses po. I'll gently palpate your maxillary and frontal sinuses lang po to check if there's any tenderness. Okay, as I observe, the maxillary and frontal sinuses are non-tender po upon the palpation, suggesting a normal sinus function. Next is, now that I am done with the assessment, I will now proceed to the documentation. Okay, for the documentation for this assessment, the nose and the sinus assessments were conducted comprehensively. The normal findings were documented po. The patient was informed of the results and there were no indications and abnormalities or concerns during the examination. Thank you so much for your time po, ma'am. I will now be referring you to the attending physician. Now, I'm going to proceed to the next assessment. Today, I'll be examining your mouth to assess the condition of your lips po, buccal mucosa, teeth, gums, tongue, and palate. This is important to ensure that we maintain oral health and address any concerns you may have po. Okay, now that I already performed the proper hand hygiene and also provide the privacy of the patient, I will now proceed to the asking the patient's history regarding on her mouth. I'll be asking you some few questions na po regarding on your medical history. Okay, when was your last visit po to your dentist?
Years ago.
Okay, do you have any ulcers or lesions in your mouth po? Are you experiencing any discomfort in your dentures po? Also, could you list or if you have some medications po? What about any pain do you feel on your teeth po? Okay, the patient has confirmed that she hasn't done or experienced any of those given situations. I will now proceed to the assessment. Now, I will start on her outer lips po. I'll start by examining the arteries for the symmetry, contour, color, and the texture. Can you please purse your lips po like you're whistling po, like this? Okay. Okay, as I observe, the lips are symmetrical, pinkish in color, and smooth in texture po. Now, I'll inspect and palpate the inner lips and buccal mucosa po for color, moisture, texture, and presence of any lesions. Okay, as I observe, the inner lips and buccal mucosa po is pink and moist and smooth. Okay, now I'll be inspecting your teeth and gums naman po. Okay, as I observe, the teeth are white and intact po. Gums are pink and there are no signs of inflammations. Next is I'll be inspecting your dentures naman po. If you have any dentures on your teeth po. Can you please open your mouth now po? Okay, as I observe, dentures are intact without any signs of breakage or excessive wear po. Okay. Next is I'll be inspecting your tongue surface po. Can you please open your mouth po? Okay, as I observed, the tongue is pink and moist po. The texture is rough due to papillae po. Next is I'll be inspecting your tongue movement. Can you please roll your tongue lang po? Okay, as I observed, the tongue moves freely without any difficulties. Next is I'll be inspecting the base of your tongue po, mouth floor, and frenulum. Can I have a look po? Okay, as I observe, the base of the tongue, mouth floor, and frenulum appear normal without any signs of abnormalities po. Next is I'll be inspecting your hard and soft palate po. Can I have a take a look po ulit? Okay, as I observe, the hard and soft palate are pink and smooth po, without any irregularities. Okay, next is I'll be inspecting the uvula using my standard pressor. Okay, as I observe, uvula is midline and moves upward symmetrically po. Next is I'll be inspecting your oropharynx po. To avoid eliciting on gag response, I'll inspect one side at a time po. Please tilt your head back lang po and open your mouth. Okay, as I observe, oropharynx appears pink po without any signs of abnormal texture. And last po, I'll be inspecting your tonsils po. I'll check your tonsils behind the fauces for color, discharge, and size po. Can I have a look po? Okay, as I observe, tonsils are pink and symmetrically without any discharge or enlargement po. Now that I am done on the assessment, I will now removing my gloves and perform a proper hand hygiene to avoid the spread of pathogens. Okay, now that I am done removing my gloves and I already performed a proper hand hygiene, I will now proceed to the documentation. Okay, based on my assessment po, the oral assessment revealed normal findings, including symmetrical lips and buccal mucosa, intact teeth and gums, and healthy tongue, palate, uvula, oropharynx, and tonsils. The client's medical history indicates routine dental care, satisfactory denture comfort, and no current oral lesions po. Without recommendations for regular dental checkups and proper oral hand hygiene maintenance. Thank you for your cooperation, ma'am. I will now be referring you to the attending physician.